Well, hello, welcome. My name is Jodi Scholes. I'm your instructor for the MBLEx review course. And today we're going to be talking about the benefits of massage. On your MBLEx exam, the benefits and physiological effects of massage will be approximately 15 questions. And so you will need to understand what is and what is not a benefit of massage and how that actually shows up. So we're going to be speaking about three, if we have time, maybe four different systems of the body and the benefits and physiological effects of massage on those systems of the body. This class takes part in 3 sessions, 3 parts, and that is the first part is some test-taking strategies. Secondly, we'll be going over our learning for the day, and today it's benefits of massage. And then finally, at the end of class, we'll be dissecting some questions. Fair warning, they're a little tricky today. A little tricky, just a little tricky. All right. So test-taking strategies. We're going to spend just a couple of minutes. So let's see, we're going to spend about 3 to 5 minutes talking about a test-taking strategy. And you'll hear me say this over and over again in class and sometimes to you individually. One of the best things that you can do to prepare yourself for the MBLEx is to increase your test-taking stamina. Yes. What does that mean? That means get used to taking longer tests. Yeah. Get used to taking longer tests. And by longer tests, what I mean is 2 hours. And so I've got a practice exam that has about 1,500 questions in the test bank. And so you get a different test every time you take a practice exam. It's similar with ABMP or AMTA, but most of us did not take 2-hour computer tests in school. Some schools did, some schools didn't, most schools didn't. And even if you did in school, how long has it been since you've been out of school? A similar comparison would be if you sit down to read. If you make time or it's something you like to do and you read, how long will you sit and read for? Will you sit and read for 2 hours? That tells me you've got the capacity, the mental stamina to focus for 2 hours. And that's what we need to build for you to be more successful at the MBLEx. And here's the thing. There are people who finish the MBLEx rather quickly, and that usually worries me. In fact, one of our most recent people to pass the MBLEx, Randy, told me he finished in under an hour. That would have me worried, to be honest with you, because it's going a little too fast. And that's why, well, why is it going too fast? I consider it going too fast because it's too easy to misunderstand the questions. And once you understand the question, a light bulb goes off. You know the answer. Yeah. And so building that test-taking stamina by taking longer tests, by taking a practice exam, but also by scheduling 2-hour study sessions. And maybe with your 2-hour study sessions, every 30 minutes you set, a timer on your phone to go ahead and get up and walk around. That's good. That's good for your body. But for your brain, what we want to do is build test-taking stamina. Make sense? And so we do that in this course through taking practice exams, through watching lectures, and through being intentional about how much time we spend studying in our blocks of study sessions. And so 2-hour study sessions, you can work up to that, right? Yeah. All right. But just keep in mind that's part of what we're doing here. We're building your test-taking stamina, your ability to focus, your ability to stay on task. I don't know about you, but when I work from home, there are so many different things that I get distracted with. I mean, golly, all of a sudden, like I need to do laundry. All of a sudden we need to clean under the refrigerator. What? Look, it's normal. We get to build our test-taking stamina, which is basically our ability to focus. So we do that through practice exams and through meaningful homework. Now, let's move on to our learning for today. Our learning for today is benefits and physiological effects of massage. All right, let's see, slideshow. Welcome back. Yes, welcome back. And so glad that you are here. So glad that you are taking the time to prepare for peacefully passing the MBLEx. So glad to have you here. We are going to be talking about the benefits of massage today, and we're going to be talking about 3, if not 4, systems of the body. We're going to start with the integumentary system. And the integumentary system is our skin. It is our largest organ, but it also includes our hair and our nails. And so for animals, it would include their hair, their fur, or their nails as well. So just like for us, skin, hair, nails. That's all of the integumentary system. So the integumentary system is comprised of the skin and all of its appendages. So with horses, it would be their hooves. With fish, it would be their scales, right? You're probably not going to see that on the MBLEx, but just know that that's the integumentary system. It is our largest organ in the body. We're going to be taking a look at the layers of the integumentary system. So we've got the epidermis, the epidermis. Okay, that's the outer layer. That's what we can see. We've got the dermis, the next layer, and we have the hypodermis. So epi, up, right? Up, epi. If you have an EpiPen, boom, it brings you back up. Epidermis, highest layer. Hypo, hyperdermis. Hypo, slow, low. It is the lowest layer. Let's look what's in each layer. Getting ahead of my slides here. The hypodermis is also called the subcutis sometimes, but mostly you'll see it as the hypodermis. But subcuticles, subcutis. Yeah, like subcutaneous fat. That's where subcutaneous fat is in that lower level. All right, what happens at each layer? So the skin's layer, so the question was, what happens at each layer of the skin? Let's look at the epidermis. So the skin's role is to protect us from the outside elements. So that can be like in the picture here, mud. Have you played in the mud lately? Yeah. And maybe just stamp some puddles. So the skin is our outside protection. Yes, it repels water, keeps bacteria out. It is a protective shield. It also, though, minimizes the loss of water. So it helps us to stay moisturized, that's the wrong word. It helps us to stay hydrated. And skin protects those things that are underneath it. So the lower levels of the skin, the muscles, like it says in the slide, blood vessels, nerves, organs, those are all under the skin. And this is a protective layer. And you'll see some of the other layers of the skin protect, but in a different way. So here it protects us from bacteria and from outside, repels outside water, but it also protects in a way that it's a layer between the blood vessels, the nerve endings, and the organs. Let's look at the dermis. So the dermis is the next layer. Let's move us over. Let's put us down there. Yeah. All right, so you can see here the dermis, that middle layer. And the dermis's role is to support and protect this, the deeper layers of The deeper those organs, that tissue that is deeper, it's the squishy, a little bit of the squishy part. It helps with thermoregulation, which just means heat regulation of the body. And it's also a little bit helps us with sensation. So if our nerve endings are still in the dermis. Most of our nerve endings are in the epidermis, but we do have some nerve endings in the dermis. So if you see the term fibroblasts are the primary cells within the dermis, or within the dermis. But there's also histocytes, mast cells, apocytes. But I wanted you to see this word here, histocytes. Histocytes are like histamines. So it's a reaction. Histamines help us to regulate our body after a bug bite. We have antihistamines that regulate our system. So histamines, those are in the layers of the skin. You can see here, I think we're going to cover these little names later. But let's go to the next layer, the hypodermis, to just cover some of the general things you'll need to know. This is not meant to be an in-depth review of the layers of the skin. It is meant to be a nice review of the layers of the skin. So the hypodermis, the subcutis, is right down here. You see this stuff here? Fat cells, yes. So this is the layer that provides your body insulation. So it also helps with thermoregulation, but mostly to keep you warm. It is also that nice kind of shock absorber. So if you get this question on the MBLEx about what is the shock absorber in your body, it is the hypodermis or the subcutis layer of the skin. This is the layer, the hypodermis, hypo subcutis. It also surrounds your organs. It's the layer that touches the organs. And so again, it provides that kind of shock absorber between the outside world and your inside world. So it gives your body a smooth contour. It does serve as some attachment sites. This is where we store our fat. And so that's where our adipose tissue, fat cells, is housed, and that's where we burn that. We get that low exercise. That's the low and slow exercise helps to burn fat. It also is the area that produces some hormones like leptin. So leptin is actually produced in the hypodermis. Go figure. And then there's some blood vessels. There's some deep pressure sensors as well. These are all in the lowest level you can see here. Sweat glands, I believe we're going to cover those in just a moment. We will, as far as the benefits of massage. So now that you're reminded of the different layers of the tissue, what are the benefits of massage? Just changing our view here momentarily. I think I'm changing our view. Ah! Okay. Sorry, I'm now like right in the middle of our slides. Okay. All good. All is good. All right, back to the integumentary system. What are the benefits of massage? What are the benefits of massage for our integumentary system? So when we massage the skin, it increases the skin temperature. It improves the skin condition. How does it improve the skin condition? It actually sloughs off. It sloughs off. Another word for that would be rubs off dead skin cells. In fact, fun fact, that dust, when dust is analyzed, over 50% of dust is skin cells, dead skin cells. Makes you look at dust a little differently, huh? But that's part of the way it improves our skin conditioning. Massage also will stimulate the oil glands, our sebaceous glands. Where are you? Sebaceous, sebaceous. There we are. Oh, that's a sebaceous. There we go. Here's a sweat gland. This is a hair follicle. These are actually sebaceous glands. There they are, sebaceous glands. So these are sweat glands, also called sebaceous glands. They're oil glands. They stimulate some oil. They also stimulate sweat. So we increase skin temperature, we improve the condition, we stimulate the oil glands, which actually helps. Again, it's another way that we eliminate waste. But it improves our skin condition by moisturizing, exfoliating, and improving the elasticity of skin, especially after pregnancy and for the old and frail. You know how when folks get very old, their skin gets kind of thin? Massage can help to improve the tone of that skin, the elasticity of that skin. In fact, in Indian culture, postpartum moms are encouraged to receive massage every day for 40 days. Yeah. So in India, the woman who has just given birth, her abdomen is massaged with special oils that allow her skin to regain its elasticity. Isn't that cool? I think this stuff is so interesting, right? Yeah. But imagine, having that as a ritual. And this is something that as you look at your practice for massage, maybe you want to make that a part of your practice. Maybe it's not every day. Maybe it's once a week. Maybe it's twice a week. Maybe it's a 30-minute session. Either way, something to consider, but that's one of the benefits of massage to the integumentary system. It improves the skin's elasticity. All right. Let's breathe. Has it been a busy day for you? Do you have a busy afternoon planned? Yeah. Let's just take a moment and breathe. Become aware of your breath. Breathing in through the nose and out through the mouth. Breathe in through the nose. And as you breathe out through the mouth, maybe it's with the ha sound. One last time. Breathe in through the nose and out through the mouth. Excellent. Just pausing for those 10 seconds, 15 seconds. Oxygenates your body, your blood, and brings you back to the present. Feel free to use that during your MBLEx. All right, the big one, the muscular system. Let's first visit the mechanical effects of massage. We've got two different types of benefits of massage. The mechanical effect specifically we talk about it in the muscular system, because the mechanical effect represents your hands like a machine. So pulling, compressing, twisting, frictioning. These are physical changes in the body. Mechanical effects are physical changes in the body. Before we talk about the next slide, let's just be super clear. There are many, many, many benefits of massage. But when we talk a mechanical effect, it is a physical change that you have created in the body. So a scar tissue maybe that has some adhesions, you have gotten in there, done some cross fiber friction, and mobilized that scar tissue. That would be considered a mechanical effect. So the tissue is lifted, it's kneaded, it's cross-fiber friction. There's a physical change happening as a mechanical effect. Compared to the reflexive effects of massage. Now, I will tell you, in general, almost all of the effects of massage are reflexive. So lower blood pressure, lowering heart rate, slowing down the breathing, more rhythmic breathing. These are all effects. We're going to learn about the nervous system again today. But am I actually going in and lowering your heart rate, lowering your blood pressure? I am not. I am creating a response in the body, a relaxation response that gives us a reflexive effect. So the body is doing it itself. Your client's body is actually making that change. As your client relaxes, their heart rate slows down. As your client relaxes, they take deeper breaths. But am I putting more oxygen in their body? I am not. But by creating that relaxation response, by creating an environment, the body has reflexive effects. So slowing down that breathing, digestion improves. We're going to take a look at the reflexive effects of massage on a different slide. Some of them, but just understand the differences, right? Mechanical, machine, cross fiber friction to get rid of scar tissue, to mobilize scar tissue. We don't get rid of scar tissue, by the way. We mobilize it. Make sense? All right. All right, so the muscular system. What are some of the benefits of massage to the muscular system? Well, it relieves muscle tension. It relaxes muscles. Muscles relax because massage reduces the excitability in the sympathetic nervous system. I believe we are going to cover the nervous system today. But remember, we've got the sympathetic and the parasympathetic nervous system. And so massage calms down. It reduces the excitability of the nervous system, specifically of the sympathetic nervous system. And so it's calming down that fight or flight response. It reduces muscle soreness and fatigue. It reduces muscle soreness because muscle soreness is often waste product that is trapped in the muscle tissue. Let me give you an example. When we work out at the gym or do a hike, but you're not used to hiking, think of a time where your muscles were sore. Typically, there's a level of activity that is higher that has caused that muscle soreness. What has happened is there's been little micro tears created in the muscles, and as the body is eliminating waste, a lot of times lactic acid, but there's a lot of different kinds of waste. Lactic acid, uric acid, carbon dioxide, all sorts of different things. But typically we're going to we'll talk about lactic acid, right? So in the muscle tissue. So massage helps to move that waste product. In this case, we're going to call it lactic acid, uric acid, all sorts of different things. Oxygen deficient blood, moves it faster out of the muscle tissue. Our body will eliminate waste. Our body is built to eliminate waste, but massage eliminates waste faster. And so that's when we look at, some of you are interested in working with elite athletes or professional athletes, or college, being maybe the massage therapist for a college team. When I worked with professional soccer, DC United, they would get massage 3 times a week. Some of them, yeah. Because they were competing at a higher level. and they were working out every day at a very high level. And so their body needed help recovering. And whether they're a soccer player or a track athlete or a CrossFit athlete, your massage will help their body eliminate waste faster and therefore recover sooner. So they won't feel as fatigued, right? So massage will also benefit the muscular system by reducing trigger points. So reducing the formation of trigger points, and those trigger points can be in muscles or the fascia. And there are so many articles written about what is a trigger point. One thing we know for sure, it's a sore part of the muscle. They're fairly predictable on where they are, but also it's an oxygen deficient area of the muscle. And so, again, massage therapy, bringing that fresh, clean blood into that area. That is how it's helping to reduce the formations of trigger points. We also manually separate fibers. That would be an example of a mechanical benefit of massage. So when we are, we pin the tissue and then we stretch it, pin the tissue and then we stretch it, we're manually separating those muscle fibers. That would be considered a mechanical benefit, a mechanical effect. The benefit being separation of that muscle fibers, spreading of the muscle fibers. We're not pulling them apart, we're really spreading them. Massage will also help improve performance. It'll help improve performance by improving balance and posture. And it increases the muscle's flexibility. In fact, so often I hear people say, oh man, I really should stretch. Yeah, stretching is a good thing. Massage also helps to improve that flexibility because it warms up the muscle tissue. It allows it, and we can even do some developmental stretching after massage. Your client may not be in the mood to do stretching, but a great time to stretch is after a massage because you're all warmed up, right? So that's how massage helps to improve flexibility, warming up the tissue, getting rid of trigger points, spreading those muscle fibers, allowing for your client to not only stretch, but potentially developmentally stretch, meaning they're developing more flexibility. They're just going to be more flexible in general. Lengthening the muscles, again. Tones weak muscles. We talked about that in terms of elderly patients, maybe elderly patients who aren't as mobile. It can help to tone those muscles by bringing, again, that blood supply into those muscles. So you can see, look at all the different benefits of massage to the muscular system. I wanted to briefly touch on the pain cycle. So the pain cycle, you see, there's a persistent pain cycle. Sometimes called the chronic pain cycle. And you will see clients with chronic pain. Just means they are never really out of pain or it comes and goes, but mostly is in pain. So take a peek here. Oftentimes we have persistent pain and it ends up being a self-fulfilling prophecy or a catch-22 because persistent pain leads to being less active. So loss of fitness, weak muscles, joint stiffness. We create kind of a no-go attitude, which when we don't get enough activity can lead to sleep problems, tiredness, fatigue, which again, weight gain, or sometimes even weight loss, right? But this can affect our brain. So we start thinking kind of negatively, maybe a little bit of depression. So we take a little time off. Maybe there's other worries that are there. And then all of a sudden there's persistent pain again. So the pain introduces what physically is happening, not just mentally. There's a painful stimulus. and then the muscle contracts. And then there becomes local muscle guarding where that painful feeling, that pain appeared. So the localized muscle guarding turns on the muscle. And sometimes, because that local guarding is persistent, the muscle forgets how to turn off. We'll look at that in terms of hypertonic muscles. Here's a bigger picture of that, so you can pause the video later if you want to see it more clearly. So this persistent pain cycle leads to that muscle not remembering how to shut off. It also leads to swelling in some people, not everybody. But this pattern, this cycle persists. There can be muscle splinting. That's simply a term that means that the muscle is guarding, and splinting really, I'm not going to define that right now, but just understand that sometimes the persistent pain does lead to muscle splinting, and that can cause more pain, a secondary pain. I want to mention before we leave the persistent pain cycle a word that I'm going to define a little later, and that's hypertonic. So hypertonic, and you'll see that, and we'll come back to that persistent pain cycle, or just the idea that when a muscle is guarded, when it's, ooh, that hurt. So we start guarding, that it sometimes the muscle forgets how to turn off. That sometimes is a hypertonic muscle, a muscle that is stuck on, kind of like a light switch, right? It's stuck on, it's forgotten how to turn off. All right, let's look at a few more benefits of massage to the muscular system. So we decrease pain, we increase circulation, massage stimulates the release of endorphins, lovely, lovely overall feeling of well-being. When a person gets a massage, that's the stimulation. When people feel really good after a massage, that's because it's stimulated endorphins, and they have just a sense of well-being. It can be, it leads to homeostasis, a sense of well-being, that things are balanced in the body. That also diminishes, endorphins diminish pain as well. They reduce pain. So massage disrupts the messages from pain to the spinal cord and can truly relieve pain patterns. It interrupts the pain cycle by softening those muscles that have guarded. It can also relieve a muscle spasm. It'll warm the tissue, improve the circulation, and improve the efficiency of removing waste. All right, let's look at ischemia as a definition. I looked for a picture of ischemia, and it did not look like anything like what it looks like in massage. I don't know where those pictures came from, so sorry we don't have a picture here. But you can imagine, ischemia is a condition where there's not enough blood flow to the body, to that area of the body. It has become, the circulation has slowed it down. And therefore, there's not a lot of nutrients, not a lot of oxygen getting to that muscle tissue. So technically, it's an inadequate blood supply to an organ or a part of the body, especially the heart muscle. But in massage, we're looking at ischemia, typically like in the traps. Maybe you'll see it in the hamstrings or calves. But there's just that the muscle is so tight that it has slowed down the blood flow. Sometimes it appears the muscle appears like cool, like white or cool, and hypertonic. Oh, hypertonic. Here's my slide. Or hypertonic or guarded muscles. So if your client has significant guarding, You can try to overcome that, but it's a battle that's going to, it's not even a battle. It's a task that you don't want to waste your time. Consider using adjunct tools. So what are adjunct tools? What are some of the adjunct tools that you've seen or experienced as a massage therapist? It can be the, what do they call those little guns? The ones that, the vibrational gun, yeah. Let me, thank you. Somebody put this in the chat. Okay. In any case, one of those guns, those massager guns, those can be effective on a hypertonic muscle. This versus your hands, okay? Because you can spend 10, 15 minutes trying to massage a part of the body that we would call armored, if there is armoring. Like maybe somebody doesn't like massage and they got it as a gift certificate and this is torturing them. And they're like, or maybe they just, maybe they're in a lot of pain. So consider others. Warm, so you could also use a some type of hydrotherapy, a heat pack, warm towels, warm wet towels, a hydroculator pack, a heating pad, a hot water bottle. These are different ways to approach muscles that are armored or hard. You can use cupping. If you're interested in learning cupping, I have a great team. I just actually took another cupping class about a month ago. It was awesome. Cupping is, I'm sure you know what it is, but sometimes, you know, with massage, we press the muscle down, we press the muscle down. Sometimes that muscle needs to be pulled up. Cupping is lovely for that. This is an example of hypertonicity in a muscle, hypertonic muscle. It's also, she's trying to do an example here of poor shoulder posture. But take a look at these muscles. They're very toned, right? They're hypertoned. Now, this is a lovely look. I think this lady's in very nice shape. If this woman was your client, how do you think those muscles would feel? Yeah, they would feel pretty tough. You know, this might be considered a tough, you know, a tough massage, just because the muscles are hypertonic. They're kind of locked on. And it's great. You can see. Good. So take a look. See how that trap attaches a little higher than this side? This would be considered a hypertonic muscle. So as you can see, there's hypertonicity in this person's body. I think her traps are about the same. We can look at her necklace to kind of tell. Maybe the right trap is a little higher. But in any case, this is an example of hypertonic muscles. This is where sometimes we find them in the levator, in the trapezius. So this nice big muscle here is the trapezius. We've got the levator right in here. This is sometimes where you might find those. Oh, and some of this content was used from an article called Save Your Hands. Some of that stuff I talked about as far as the massaging gun, the tools. These were examples taken from the article Save Your Hands by Mr. Goggins. All right, a couple more terms that I want you to be aware of in terms of if they show up on the MBLEx. Sometimes they will misspell words or spell them like out of the medical dictionary. You probably won't see this other spelling of hyperemia, but I wanted to compare and contrast hypertonic with hyperemia. Hyperemia is technically it is the increase of blood flow. It's the pinkness in the muscle tissue once you have massaged it. That pinkness, that effect is called hyperemia. So technically it's the increase of blood flow in the blood vessels. The benefit of hyperemia is that it softens the muscles. It actually warms up the muscles. And the way we create hyperemia is either through petrissage or rhythmic compressions into the muscles. Like, for example, into the gluteal muscles. It's a nice place to use rhythmic compression. And that creates hyperemia. Benefits of massage to the connective tissue. So one of the benefits of massage is that it reduces keloid formation. This is called a keloid scar. And you can see it's kind of thick. Yeah. So massage therapy can help keep that scar from becoming so thick. If it's in its healing stages, it's later healing stages. If your client presents with a scar like this and it's been 10 years, you can go ahead and mobilize that scar. There's several type of classes you can take to learn how to mobilize scars, but do the best you can, right? Massage will help to reduce keloid formation. It will also help to reduce excessive scar tissue. So here we're seeing an Achilles tendon that's been repaired, and it can help to mobilize that scar tissue and to allow, because that scar tissue tends to attach to the underlying structures, to the fascia or the muscle or the tendon. And so by mobilizing that scar, we can actually mobilize the area and decrease the adhesions. Massage helps to release fascial restrictions. That means restrictions in the layer of skin called your fascia. It also improves connective tissue healing. So if something is healing, again, by feeding that with healthy nutrients, healthy blood supply, it improves that tissue's ability to heal due to the timing of the heal. It speeds up the healing process. It can also help to, massage can also help to reduce the appearance of cellulite, the dimpling of cellulite. Again, there's very specific massage techniques and also some tools that help with that. But you can see a before and after picture here from a massage session. All right, we're switching gears here for a minute. Let's see. Okay, switching gears. I believe we are going to talk about, let's see what we're talking about next. We're winding down with the general effects of massage. So we talk about the benefits and physiological effects of massage. So it reduces fatigue and increases vigor. It can help to improve sleep patterns. Did you realize that? If your client has difficulty sleeping, consider seeing them at the end of your shift, maybe closer to dinner time or after dinner. It can help improve the quality of sleep. It also reduces job-related and post-traumatic stress. So if there's been a stressful event or there's a lot of stress at work every day, massage can help to reduce that, the feelings of that. Massage will improve a person's mood. And massage has also been proven to make people feel less aggressive. So I like to think about that in terms of driving, right? So wherever you're practicing massage, there are less aggressive drivers. Wherever you're practicing massage, it's a better zip code to live in because people are just friendlier. Oh, serotonin. Do you remember serotonin? We talked a little bit about improving sleep patterns, so I wanted to remind you serotonin is a chemical that's present in the body. It affects mood and sleep patterns and digestion. And so massage can help to increase the amount of serotonin in a system and also help to regulate those levels of serotonin. And it's a chemical that carries messages between your nerve cells and your brain. Hopefully you'll never have to know that. but just know that it's a lovely chemical that naturally occurs in your body to help with mood and sleep is normally what we hear about. But also look at these other things: digestion, wound healing, blood clotting, libido. Massage also improves a person's overall body image. By getting back in touch with our body, we feel better about it. Thank you. This is a picture that was from Dove, the soap. I love it that they used all sorts of body sizes and shapes. Every now and then we could get a little diversity in there too. So promotes massage also promotes more expression, promotes communication, promotes more expression. It just gives people that feeling of calmness, and it promotes clearer communication. When somebody feels good about their body, it can help to improve lifestyle choices, lifestyle habits. So another benefit of massage. And of course, we know that stress contributes to a lot of different problems that we have in our physical body and in our mental body. So massage enhances our well-being through relieving stress. And for those people who are looking to improve their comfort level with touch, massage can help with those folks who feel like they are touch adverse or very sensitive to touch. Gentle massage can help with that. Did you realize that massage helps with academic performance? It helps people think more clearly. People do better on math problems after getting massages. It increases mental alertness. And we all have a primal need to be touched. And so massage can satisfy that emotional need. We all have a primal need, a primal desire to be comforted. And massage is a safe space for that. Woo. There you go. Those are some of the many benefits and physiological effects of massage therapy on the body. Ready for dissecting some questions? All right. Let's do it. All of these are benefits of massage to the connective tissue, except. All of these are benefits of massage to the connective tissue, except. So A, decreases adhesions, B, releases fascial restrictions, C, slows down connective tissue healing, D, reduces surface dimpling of cellulite. So let's take a look at the question. You can put answers in the chat if you'd like. All right, so let's take a look at this question. All of these are benefits of massage to the connective tissue, except. So we are looking for the answer that is not a benefit of massage. All of these are benefits except, and benefit to the connective tissue. A, decreases adhesion formation, releases fascial restrictions, slows down connective tissue healing, reduces surface dimpling. Let's take a look. Let's eliminate one wrong answer. So what do you know of these, A, B, C, and D? What do you know is a benefit of massage? Great. So we know that massage does decrease adhesion formation. Yes. So of the remaining three, what is a benefit of massage? What is the benefit of massage? What is not a benefit of massage? Okay, even me getting confused, right? All right. Let's see. We've got some answers in the chat. Open sesame. Very good. Nice, Nuyo. Nice, Tanya. Nice, Pumla. And Lana, I saw you answering. Boom. Boom. Slows down connective tissue healing. Massage does not slow down connective tissue healing, right? It speeds up connective tissue healing. So this is an example of a tricky question because we had to look for what was not a benefit of massage. All right, good job. So all of these are general benefits of massage, except increases fatigue and increases vigor, improves sleep patterns, reduces job-related and post-traumatic stress, improves mood. Okay, another one of these except questions. So all of these are general benefits of massage, except increases fatigue, increases vigor, improves sleep patterns, reduces job-related post-traumatic stress, improves mood. All right, we're going to take a look at one wrong answer. We know it does improve sleep patterns. Let's see what you got in the chat. Oh, you caught it. Yes, Pumala, Lana, Val, Nuyo, Tanya. You caught it. Boom. Increases fatigue and increases vigor. It does not increase fatigue, right? Exactly. Exactly. So it does increase vigor. Vigor is, oh, I feel vigorous, right? But it does not increase fatigue. It decreases fatigue. So what you just did there by answering that question was you were thinking critically. You were critical thinking. You looked, you identified, you answered. Good job. All right. Reddened skin associated with increased blood flow is called blank. Reddened skin associated with increased blood flow is called A, hives, B, ischemia, C, hypertonicity, D, hyperemia. We're going to get rid of one wrong answer. Not talking about hives. And hives has nothing to do with blood flow. Oh, I see some answers. Good job. Let me see. Let me call. Give me a shout out. All right. Val got to it. Pumla got to it. Nuyo, Tanya, Lana, yes. Yes, yes, yes. Hyperemia. Reddened skin, that pinkened skin that's associated with increased blood flow is called hyperemia. Hyperemia, good. Hypertonicity, not so good. All right. General massage effect that includes change in blood pressure and serotonin levels could be, this is a definition. General massage effect that includes changes in blood pressure and serotonin is known as A, mechanical effect, B, physiological effects, C, psychological effects, D, reflexive effects. General massage effect that includes changes in the blood pressure and serotonin levels. All right, let's eliminate one wrong answer. We know that's not a psychological effect, right? Because we're talking about the body, not the brain. So blood pressure, serotonin. Serotonin does improve mood, but we're not talking about the psychological effect. Let's check out our answers. Nuyo, Pumla, Tanya, Lana, yes. Yes. A general massage effect that includes changes in blood pressure and serotonin levels is called a reflexive effect. Yes, the reflexive effect. It's coming from the inside. The body is doing it on its own, right? Okay, another general massage effect question. General massage effect that includes reduced anxiety and heightens a person's sense of well-being is called A, a mechanical effect, B, a physiological effect, C, a psychological effect, D, a reflexive effect. All right. General massage effect includes reduced anxiety and heightens a person's sense of well-being. Well, let's take mechanical effect out of there because that's not a mechanical effect. We're not reaching in and reducing someone's anxiety. Ooh, I see some answers. Ooh, yes. Pumalana, Nuyo, Tanya, you got it. You got it. Reduced anxiety and heightens a person's sense of well-being. That general massage effect is called a psychological effect. Now, would reflexive have been correct? It would have been an answer. It's not wrong. But the best answer was psychological effect. The best answer. All right. So all of these are benefits of massage, except, so again, these except questions. All right. All of these are benefits of massage, except, okay, let's find the one that's not a benefit. Relieves muscular tension, relaxes muscles. Relaxes and massage reduces excitability in the sympathetic nervous system, calming down the fight or flight response, decreases the production of serotonin, reduces muscle soreness and fatigue. All right, we're looking for what's not a benefit of massage. All right, let's get rid of one. I guess we didn't get rid of one wrong answer on this one. Oh, I see the answers in your chat though. Let's see. Yes, good job. Nuyo, Pumla, Tanya, Val, Lana, yes. The correct answer is all of these are benefits of massage except decreasing production of serotonin. We actually increase the production of serotonin or balance the production of serotonin, not decrease. We decrease cortisol. We can decrease adrenaline, but we increase or regulate the production of serotonin. Good job. Hey, all right. Congratulations. Nice work. You have just spent the last hour studying for your MBLEx. Congratulations. Good work. So nice job. I'm going to wrap up the recording here, but I'm going to stay on for a little while longer with the students who are live in class in case they have questions. So I'll sign off by reminding you my name is Jodi Scholes. I am your instructor for the MBLEx review class. This class works that we meet once a week on Thursdays at noon. Next week, and if you're listening to this, we will have already kicked off our business classes. For those who are a part of this class, yeah, great. Bye, Puma. Yeah, bye. For those who are part of this class, there are many who pass the MBLEx and launch into their massage career. So offering business classes now on Tuesdays at noon for those who have passed the MBLEx or passed their state exam. So thanks so much for being a part of today. I'm so happy that you're taking this time to prepare to pass your MBLEx. You got this. All right, we'll see you again real soon.